Fwp Podcast. All things health, wellness, fitness, and education through the physical therapy perspective. I am Dr. Amy Bullock, owner and founder of Fortress Physical Therapy. Fortress PT is here to serve the Charlotte metro area by highlighting the importance of how and why physical therapy should be a part of your health and wellness lifestyle. Here we go. Welcome to Season 7, Episode 6 of the Fwp Podcast. I'm here with you today, Dr. Amy. How are you? Thanks for the listen. I greatly appreciate it. Quick side note, if this is your first time listening, make sure you subscribe. Also, know that these podcasts are also up on the Fortress Physical Therapy YouTube channel. So you can still access these podcasts on the FPT YouTube channel and listen to them while you drive. Unfortunately, you don't get my face with these. It's just the audio, but still another platform to listen to these podcasts, just in case your perhaps iTunes or Apple Podcast isn't working, or Google Play. Know that you do have access to them for free. So, digging into today's, did I just mature there? Today's topic, something that is definitely to my attention a little more, even though this is kind of the purpose of what I do to help my patients and athletes. But a close friend / athlete of mine is currently going through this. So, okay, so today's topic: how to make progress in the presence of injury. And I'm not talking like a muscle strain. I'm talking a little bit more serious injury. So a patient of mine / athlete immediately contacted me. I'm going to tell you this little story real quick, and then how we are navigating this. Currently at this moment, this is 1 week post her sustained injury. So one of my athletes, unfortunately, but maybe fortunately in disguise, sustained an ACL tear in her knee. So about a week ago, she performed in the CrossFit Open on a Friday and did 23.2. She did awesome, nailed it, looked super strong that morning. And then later on, she had to go to work and jumped in on a practice game with her athletes and injured her knee. And I was working that day, and I received a text message from her, and she's like, I need to call you. Can I talk to you? I'm like, well, I'm in between patients here, or I will be in between patients. Give me 30 minutes. So we connected, and, lots of emotion going on, but she's like, I think I tore my ACL. Can I see you today? And literally, this happened an hour right before we got on the phone. I was like, yes. I was like, come in and see me in an hour and a half when I'm finishing up with patients. So she came in, we did some treatment. Of course, I did some assessment, right? And based on my assessment of the knee injury that she sustained, it pointed me towards the ACL possible. So we did some treatment. I actually did some dry needling. We did some dry needling on her quad muscle and kind of around the inner aspect of the knee joint and a little bit into the calf muscle, and just did some gentle range of motion, and then educated her a lot about the process of possible pathways that the knee injury could be, right? Could be ACL, could be MCL sprain, could be meniscus involvement. The kneecap could have went out of place and went back in. So I'm just really trying to educate her as much as possible. And then she was going to follow up with the team orthopedists the next day on a Saturday. So from then on out, we stayed in direct communication via text message as well as phone calls if we needed to. So she saw the ortho, and he believes that there is a ACL tear. So currently right now we're waiting for imaging via MRI. But I saw her that following Monday, and throughout the weekend we stayed in contact, and a lot of emotion going on. So it is my duty and job as her tending healthcare provider, one of her healthcare providers and physical therapist, to try to keep her as calm as possible and to provide her with positive reinforcement, right? Because when something like this happens, and she's a pretty elite athlete herself, we need to help coach our patients to be in control, to control the controllables. So I immediately messaged her and texted her. I'm like, okay, listen, I know we got a lot of emotions going on. We don't know what pathway you're taking right now, but here's what you need to do. You and I need to do. We need to control the inflammation, i.e. the swelling, right? Because when swelling is in the knee joint becomes stiff, and therefore you do not want to move it, and then pain sets in. So if we can control the inflammation and swelling, which then helps us improve range of motion, she can function a little bit better getting around the house, coaching her practices. Additionally, not only controlling inflammation, swelling, and range of motion, but getting some type of daily exercise in, right? Because we need to pump her heart, right? Because her heart is going to push blood everywhere else in the body. So super important to get some cardiovascular input. So she has access to a Concept 2 bike. She has access to our CrossFit gym's equipment. So I said, you know what? We need to get on the bike first and foremost. And another reason for the bike is that it also promotes range of motion within the knee. And she's in control. Additionally, nutrition. She needs to stay on top of her nutrition. Don't eat shit food, right? Not a lot of sugary food. We need to be zoned in on our nutrition. So getting quality protein, getting complex and simple carbohydrates, a little bit of fat, right? Maintaining her consistent approach. And then that leads into trying to be as consistent with the sleep routine as possible, even though her knee is going to experience pain and discomfort, and overall her body and her sleep will most likely be disturbed for the first week or so. We need to try to control that as much as possible. Those are kind of the little bit of the standards we have promoted for her, that she can regain control again of herself, of her body, until she figures out what pathway to walk down with most likely surgery in her future. So how to make progress in the presence of injury. So this athlete of mine has probably most likely sustained an ACL tear, will most likely go under surgery, will go the surgery route. So some things that her and I have spoke about, even in this process of waiting, I expect her to be at the gym every day doing her rehab, the rehab standards that she and I set for her. being purposeful while she's here, navigating what she can do and cannot do until she does go down that surgery route. So a good example is, doing some seated movements, right? Because it's hard for her to put weight bearing through that leg. So sitting on a tall box and doing some upper body movements or general range of motion into her affected knee, as well as, taking pressure off of that knee. So using the non-involved leg as well as your arms and your heart, right? So I liked utilizing the bike in this case. She did test out the rower and she was like, I don't think that's for me right now. So we said, okay, the bike is totally your friend. That is what is going to be utilized within your fitness and conditioning. So we set the rehab standards initially right off the bat. So I wrote her up a little prehab program that she needs to abide by, and then we will reassess and make that a little bit more progressive based on her range of motion tolerance. So how to make progress in the presence of injury, or if someone, as this example, has an actual torn ACL and wants to get back to the game field, right? And is going to continue to be active, we have to control the controllables. So inflammation, range of motion, setting good rehab standards, both from her perspective and the physical therapist perspective. Daily exercise, it is non-negotiable. I want her in the gym every day. And I know if she's checked into the gym or not, because she has to sign up for open gym classes. So I can see that as a physical therapist and as her CrossFit coach. Checking in, make sure she's staying hydrated. How's the swelling in the leg? And truthfully, yesterday saw her, because 2 days ago we had physical therapy. I did a lot of soft tissue massage and swelling to kind of milk that edema that developed into her ankle and push it up towards her heart, up her leg, into her thigh. And yesterday, significant difference. Like, she looks like she has an ankle again. Right? And then making sure that her sleep patterns are becoming better, her recovery's better. And cool thing about that, I can monitor her sleep because she has a Fwp band. I'm not sponsored by them, although I should be. And I can see her recovery and her sleep, how much sleep she got that night leading into the next day. So it's super cool that as a physical therapist, I can monitor all of this. And she sees that and knows that. In utilizing her non-affected leg and her arms and her heart in order to rehab and prehab and keep her fitness levels as much as possible, right? So in general, just to kind of spout out some general considerations on how to make progress in the presence of injury, some things to consider are lowering your intensity output. So in this case, this athlete of mine, she is a pretty high level CrossFit athlete. So we have to lower her intensity output, right? And focusing on daily movement or low intensity, steady state cardio. If you are able to walk and you did not sustain a lower body injury per se, then getting daily walks throughout the day, each day, will help with making progress in the presence of injury. Focusing on nutrition, especially protein, right? Protein is the building block of our muscles. So we need to make sure that we are staying on top of that. And then not only nutrition quality, focusing on protein, but sleep quality and recovery processes. So setting the standard for yourself, as well as your physical therapist setting the standard and expectations to maintain as much of a sleep pattern as possible. And another thing that I didn't really get into, but I believe I spoke on this before, is utilizing, those non-sexy physical therapy bands, the mini loop bands, the more rubber band type external resistance, right? Because in this case, my athlete, she is able to put 215 pounds above her head with ease. And now we need to a little bit lower the expectation and consider, okay, we still need to get some good load. So utilizing bands, utilizing kettlebells, dumbbells, emphasizing seated positions in order for healing to occur. Those are some things on how to make progress in the presence of injury. And in this case, talking about my example with my current athlete that I'm helping through her ACL injury. So, general considerations again, lowering your intensity output, utilizing bands, kettlebells, dumbbells, some barbell here and there if you're able. Focusing on low intensity, steady state activity or cardio, nutrition quality, especially protein intake, and then trying to be as consistent with your sleep quality and patterns, therefore maintaining and improving recovery. And also, side note, I know this is a longer podcast, and I'll probably talk about this later on at some moment, whether on a coffee talk or another, podcast. Utilizing pain medicine over the counter, Tylenol, ibuprofen, Advil, naproxen, etc., Bayer aspirin, that is part of coping a little bit with injury, as well as helping with the inflammation and pain tolerance. Now, I'm not a physician, I can't prescribe anything, but over-the-counter medicine is totally a thing with helping with the recovery process or making progress in the presence of injury. So that will be for another topic. But hopefully this gives you some insight and some things to think about to be able to control the controllables. And know that having an awesome physical therapist in your corner with direct communication that can help lead you down the right pathway and help you be able to be in as much control as possible. So, any comments, any questions, definitely drop it below and reach out. And if there's any other topics, perhaps you guys may want some input from me from, definitely send me a direct message on Instagram. I'm most active through there. And we will catch you. That's a wrap for today's episode, Function with Purpose Podcast. For more information on this episode, please check out the show notes within your podcast app. Be sure to subscribe, like, share, or drop your comments and questions below. Follow us on Facebook, Twitter, Instagram, Google, YouTube, and LinkedIn. Thanks for the listen. Pursuit, precision, purpose.